Welcome back to the Pelvic Health Summit. I'm your host, Hannah Matlock, and we are here today with Sallie Sarrel, a pelvic floor physical therapist based in New York City and an endometriosis advocate. Thanks for being here today.
So exciting to be here with you.
I'm excited to talk with you about your experience and your knowledge and everything that you do. Can you first tell us how you got started in this career, a little bit about your story?
After years and years and years of suffering and not understanding why, and going to doctors for hip pain and seeing so many doctors for stomach aches and food allergies and back pain and heavy cramping. After 23 years of that, I was diagnosed with endometriosis. Unfortunately for me, diagnosis came after a 7-centimeter endometrioma had already ruptured. So the first surgery just took hours and hours of cleaning that up with Excision, and I was lucky enough to be able to access Excision for my first surgery. And then coming out of that first surgery, the doctor said to me, look, you're in medicine, your whole family's in medicine, you have a huge family background in gynecology. If this happened to you, if this happened that no one heard you and you were minimized for so long, you have the power to make it so that it won't happen to anyone else. And so in that moment, I incorporated a physical therapy practice. I had phenomenal manual therapy skills, and I opened a business.
You were already a physical therapist?
I was already a pelvic health specialist.
Okay,
and yet I didn't know I had endometriosis. And that even in pelvic health, that shows how far our curriculum has come, because we didn't talk about endometriosis when I was being trained. This is many years ago. Now they talk about it. We just talked about incontinence and postpartum. We never talked about the pelvic pain side. It's one of the reasons why I'm so happy to be here with you all today, because the level of education that you can provide to everyone is so important. And so I created in that moment a pelvic physical therapy practice to welcome all people with endometriosis, to treat them with love, kindness, and compassion, to guide and coach them through the journey and the wellness path that is endometriosis, and to welcome the unmentionable pain. Unfortunately, along the way, I have endured 6 and now upcoming a 7th surgery, treating everything from ovarian torsion to having an ovary removed without consent, to having multiple hernias treated, multiple IVF cycles to no avail, so I was never able to have a child. And for me, even using good care, the best surgery that we can have in the United States, and the best physical therapy, because everybody wants to help me, diet, exercise, acupuncture, yoga. It's been a long journey, and I think it's very important to stand up tall and to teach the world that healing isn't linear and that there's ups and downs, and that's what we can learn from treating pelvic pain, and we can still be successful, highly functioning, happy adults, even enduring what the endometriosis journey is.
It's incredible how you've been able to turn such a negative experience into a positive, and now you've dedicated your life's work to healing so many people who have endometriosis and pelvic pain. So thank you for doing that. And thank you for telling your story. I'm sure that there is a lot of people who this resonates with and who can relate and connect to everything that you just shared. Can you talk a little bit about how all these experiences shape the way you treat your patients in your practice?
I think the first thing that I do in my pelvic physical therapy practice is listen. And
which is so important.
Yeah, no matter what, you have to hear what the patient or the person is saying. If the partner comes, you have to hear what the partner is saying. If the mommy comes, you have to hear what the mommy is saying. And I even have dads come. So anyone around the person with endometriosis also has endometriosis. Now in my house, we know this really well because my father gets it the worst. When, I have thrown things, I have screamed. So that means when I'm in pain, everybody around me to some level is experiencing the pain. And I think offering a practice where you hear them first, because that average length of diagnosis is 8 to 10 years for endometriosis. Along the way, they have been minimized and belittled, and sometimes you can barely see the person in there, but the person is always there. And in my practice, I hear you first. I also have a one-on-one caseload. I don't treat multiple people at the same time, and I offer that full hour as a safe space, and I offer, a whole array of manual therapy techniques, and I offer exercise techniques, and my goal is to empower you over your pelvic pain, because no person should miss out on school, career, social participation, or motherhood because of pain and painful periods.
So what type of symptoms are your patients coming into your office with?
My patients come into my office with anything from painful periods, IBS, pubic bone pain, painful sex, back pain. I get a lot of rib dysfunction because of the connection between the diaphragm and the pelvic floor. I get even throat pain because the throat is the top of the diaphragm. And in my practice, we see a lot of occult hernia. So I get a lot of groin pain. I get generalized deconditioning because when you have endometriosis, let's be honest, half the time you're laying in bed curled up in a fetal position. So everything gets tight. And then once you're down the road to excision surgery, once you're working on feeling better, you have to lengthen as you strengthen.
Can you talk a little bit about the connection between endometriosis and hernias? I know that you diagnose this a lot in your practice.
We noticed about 18 months ago that there was and we don't understand why. I have a theory of why it happens. But I noticed about 18 months ago that my patients come in, and myself, groin pain, labia pain, pubic bone pain, and genital itching. And the itching is not related to yeast. And so we have to start to wonder when you have itching and labia pain like that, is it from a nerve? Years ago, anything genital, we used to just think, oh, that's the pudendal nerve. But if you really take out a picture of the way the nerves innervate the genitalia, you can see that the ilioinguinal nerve and the genital femoral nerve run down around the genitalia and into the groin and into the labia. So when I started to map out all these things, I started to see this huge connection. Now, in myself, being a national champion in tennis, when I had my hernias, I couldn't play anymore, and that's like my love, and I've suffered a lot, and I want to be able to go out and do what I want to do. And I see patients telling me the same thing. So we started to find in 1 year, in this small private practice, I found 22 cases of occult hernia. So at this stage in my research, we're looking at documenting that they happen. We don't have a theory as to why they happen. I think what happens is people with endometriosis are the most amazing people at getting themselves out the door because everybody has told them their pain isn't real. So like they get up and go through their day no matter what. And many times the pelvis is frozen by the adhesions from the disease. And as they're moving with this frozen pelvis, they pop off a piece of fat into the extraperitoneal space and they compress the nerve. So that's my theory. I don't have the research yet to prove that.
How are you able to tell when a patient has these occult hernias?
I'm the hernia whisperer. I do a nerve mapping, and I have developed a specific technique with my hands. And then the best part is I have really built a referral network that understands the importance and the role of occult hernia in women and in men. I had a post today about how in men a cold hernia causes infertility. Just happens to be that I treat people with endometriosis, so not as much male hernia. But I have this network and we work seamlessly. I work with the physiatrist, and one of the diagnostic things we can do is drop a injection of Triamyl and lidocaine into the nerve. If that halts the pain even for a few hours, then we have a high suspicion. I have a team that can read the MRIs, and then I have a team of endometriosis surgeons that understand the importance of having multiple causes of pain. So, with endometriosis, we can excise the lesion at its root, but even after the lesion is gone, there are so many causes of pain that need to be attended to, and you have to work with a team of specialists that understand it's not one and done in terms of surgery. It very well may be surgery and diet and managing your bladder and managing a hernia and managing your pelvic floor and learning how to exercise again and learning how to love again, and that includes self-love and love of yourself, because it's been such a long journey. And so getting to wellness, you have to have that team put together.
Who are some of the other specialists that you work with? Can you talk specifically about what they do and the role that they play in this network of the care team?
Well, for me, my number one partner typically is the excision surgeon. And if you don't understand what excision is taking the lesion of endometriosis out at its root. So birth control pills, they can only cover the symptoms or mask the symptoms of endometriosis. Cautery or burning of the disease, that can only burn off the top of the disease. For me, my patients, I want to do the best that there is for them. So I typically work with the excisionists of endometriosis, and I work with everybody nationwide because I have that reputation as a physical therapist that people come in to see me. So that's my number one, whether it's somebody that's here local in New York, somebody that's in Massachusetts or Gig Harbor, Washington, or Texas. That's typically a part of my care team is the endometriosis excision specialist. The other part of my team is the physiatrists. And the physiatrists, I always say, they're orthopedic sleuths to the pelvic floor. They are a critical member of the team in that there's things that I just can't do. Once you have endometriosis, oftentimes your central nervous system, the volume gets turned all the way up. And listen, if somebody took a hammer to your pelvis for 15, or in my case, 23 years, just removing the hammer, the body's already, the body's already made all these adaptations. So pelvic floor physical therapy is one way we can adaptation, the whole body. So, from the foot to the top of the skull, we can change and work with you and work with everything that you do in your daily life to try to get you to feel better. But the next level is that I need an MD sometimes to work with meds, sometimes to order testing, because again, you could have a labrum tear because you were walking funny. I got my labrum tear from the way they pulled me into the stirrups to do my IVF. And so that affected my walking for many, many years. You have to treat that. You can't just assume that it's endometriosis. And so that next level of care means being one-on-one with the pelvic physiatrist. I also am lucky enough that I have a hernia specialist in my pocket at this point. At any given moment, I have a urologist who is working constantly if the person has IC, because we know that 60 to 80% of women with endometriosis also have some form of bladder dysfunction, whether it be a full-blown painful bladder syndrome or IC, or it just means a little central upregulation in the bladder. I also have a nutritionist that I refer to, and I fully believe in mental health counseling as well, because this disease impacts how you are in your heart and in your soul, how you interact in society, and how society interacts with you. You live many times in a prison by your body, and you're at war all the time, even when you live successfully. And it's time to loosen the stigma that you should go through surgery and be fine. It takes a team, and the team has to also include mental health counseling, because we are strong and amazing people as people with endometriosis, and whatever it takes to get us there, we have to be free to be who we are.
Thank you. I think it's so incredible that you've built this care team in New York, and also you have connections with many other doctors throughout the country. And I hope that other endometriosis specialists and pelvic pain specialists will realize the importance of having all of these specialists and referral doctors to send their patients to, because as you've touched upon, one person is not going to be able to solve the whole picture and address the multiple pain generators and the trauma that has happened to your body over decades of time. But what I am curious to ask you is, you touched upon it a bit before, but as it takes patients so long to be diagnosed with endometriosis, and they're told for so long often that their pain is in their head, that their pain is not real, have you seen more recently, as awareness for this disease is growing, have you seen the patient's knowledge change and their understanding and their insight into the disease grow and change as well?
Nancy's Nook for Endometriosis on Facebook has created a revolution in endometriosis education. And I will fully disclose, I am an administrator in that Nook, and I've been there since the beginning.
When was it started?
So we started as the Endometriosis Research Center group, and then Nancy took it over on her own. So I want to say we've been there anywhere between 7 to 9 years. But Nancy was the original nurse in endometriosis who had been very, very ill with endometriosis and thought that that was going to be her life, and was walking down the hallway in her hospital in Oregon where she was a nurse, and heard some guy talking about excision and endometriosis, and that happened to be Dr. David Redwine. And the two of them took on the world to teach excision to the world. And Nancy's opinion was, I'm not going to let anybody else have the life that I had. So with the onset of the Nook, people know now this is what excision is, this is why ablation fails, this is why retrograde menstruation is an outdated, ridiculous myth. And I believe, if you cannot change this disease unless you empower the people to vote with their feet, to open their mouths, and to stand up and to make a difference. So that's one huge change that I see is the Nook. The other thing that I just touch on is advocacy and Google. It can be a double-edged sword. So now we know excision, and now we know what endometriosis is, but it can be abused in many, many ways. So, we see it all the time that celebrities talk about how hysterectomies cured them. We know that hysterectomy is not a cure for endometriosis. We see lots of discussion on retrograde menstruation. To me, the myth of retrograde menstruation will continue to damage women and cause needless hysterectomies for so many years. We have to make a difference.
Can you explain what retrograde menstruation is?
So I think it's in 1929, this guy Sampson decided on cadavers that he was operating on. When he opened the cadavers up, he saw lots of these little black spots in women who had died of hysteria. And he said, oh, look at this. There's a hole between the tube into the peritoneum. The blood must come out of this tube into the peritoneum and make them hysterical. And he decided that what was coming out of this tube was endometrium. Okay, thus the name endometriosis. Except that we now know, and then let me tell you, since that time, nothing has changed. The research is very far behind the times, except that we now know that under a microscope, endometriosis is not endometrium. It's tissue similar to, but not the same as. We know so many things. You can sew up that hole. The person still has endometriosis. They still get more endometriosis. You can take out the uterus so there's no blood to backflow. Person still gets endometriosis. We know that retrograde menstruation is a theory that has failed so many women. What we believe is that the disease lays down when you're in utero, and we don't really understand the mechanism by which it becomes hormonally reactive. So that if you remove the disease at its root, it shouldn't grow back. Are there cases where it grows back? Yes. More likely, there are cases where more disease has emerged in new places. I fully disclose that I believe that endometriosis is a disease of many strains, so that my endometriosis is not the same as yours or anybody else's. For example, the flu. You get vaccinated for that one strain of flu, but you can still get the flu because there's tons of flus. So with endometriosis, we are beginning to come to the understanding that not all endometriosis is the same. So excision is our best weapon against it, and then I believe physical therapy afterwards. But that concept that if you stop menstruation, or that endometriosis is only driven by menstruation, which is retrograde menstruation, that theory is dead, or it should be.
Why does excision surgery have such greater success rates than ablation?
During ablation, you burn the disease off the top, but you do nothing to the root of the disease. During excision, you take the disease out at its root. And so, if you're weeding, like it's springtime now, if you're weeding your garden and you just take the top of the dandelion off, what happens in a week?
Grows right back.
Right. So in excision, you have to go down into the root of the disease and fully excise the lesion.
And I think that this is something slowly people are starting to understand more and more.
I think people are starting to understand it more and more. Where we run into the problem is that the standard of care in the United States, set by American College of Obstetrics and Gynecology, does not include excision surgery. The standard of care in the United States pretty much says first you do birth control pills, then maybe an ablation, then some Lupron, which we know Lupron doesn't work because it shuts off the period, but endometriosis has like so little to do with the period. And then if all else fails, hysterectomy. That's an outdated standard of care, and we have been waiting for ACOG to change it. And there is a whole movement Casey Berna did a petition, Endo What has done a lot of push to have that standard of care changed. And the standard of care impacts you, me, and everybody else because I was told, even though I'm a major player in endometriosis, all women over 40 need a hysterectomy for endometriosis, which isn't true because we know and that doesn't work. The other issue becomes that you cannot access excision on the corner from any gynecologist because the only thing they're being directed to do is the standard of care set by the American College of Obstetrics and Gynecology. So until the standard of care changes, we won't get accepted care for all. And that's, for me, the driving force behind the Endometriosis Summit is to mobilize like the entire world to stand up and say, I've had enough and we're going to change this. The other side of the coin is if the standard of care for endometriosis doesn't change, we're not going to be able to educate the excision surgeons, and the excision surgery will become a dying art. Because as long as the standard of care says ablation, it's not really coverable by insurance. And then what 30-year-old comes out of med school with all those loans and everything going on and wants to go into excision and not get paid for the time he's in there excising or she's in there excising. So if we don't bring about change, you won't be able to get care, but then the next generations of doctors won't be able to deliver it to us either.
So what can the audience do, there's listeners and watchers throughout the world, to help move this standard of care forward?
The most important thing is to understand how the standard of care impacts you. So we just taught you that. The other thing is to get in touch with the organizations that are moving the standard of care forward. And I always say to start because I'm US based, but as long as the standard of care remains like this in the US, other countries will not follow suit. So I know that Canada has a tremendous problem accessing endometriosis surgeons because of the way their healthcare system is. They're also having a lot of trouble educating good endometriosis programs so that there are more surgeons. So I say connect with the societies that are making a difference. So endowhat.org makes a difference every day in terms of the standard of care. Casey Berna has led the fight. I think she's caseyberna.com for the standard of care across the United States. She's led the patient protest. Endometriosis Research Center, as well as from the medical side, AAGL, which is the Surgical Society for Minimally Invasive Surgery. They have done a huge push to challenge ACOG every day to change their standard of care. When we held the patient protest, one of the things that Casey Berna made sure to do was to give it a global access point. So we actually shut down the ACOG Facebook page with all our tweets and messages, and it's mobilizing like that. You may think sending a tweet that says, hey, ACOG, we matter, is like nothing, but it builds up over time, and it's time for us to chip away. And you can do that no matter what country you're in, because until we vote with our feet, until we raise our voices, there's no reason to change anything. Pharma loves the way that things are right now. They have no motivation to change the standard of care because they make money off of the drug. And if standard of care says drugs work, then why would pharma put any money into anything else? So until we challenge the status quo from wherever you are, from Twitter, Facebook, Instagram, from writing a senator, from challenging whatever your government is, to going to whatever conference is local in your area, from the World Congress of Endometriosis that'll be in China next year, to AAGL, which will be held in Canada, to SLS, which is held in New Orleans, to everything worldwide. Until we as patients say we've had enough, it's not going to change.
And what about the medical management pharmaceutical route to endometriosis? You mentioned a bit before.
Not every person with endometriosis wants to run into excision right away. They want to, because it's invasive, and I understand that. And of course, pelvic physical therapy is a great way to manage symptoms. So many people try medical management of the disease. But here's the reality. Birth control pills, and now the new drug on the market, Orlissa, it's a Band-Aid over symptoms. Because we talked about if the disease exists and has a root of the disease, just turning off the hormones or just turning off the period doesn't actually do anything for the wad of disease. And so the issue, especially in the United States, is that if pharma drives the research we have for endometriosis, then how can we have research on an even neutral playing field? You want to take a drug, fine. Please have somebody disclose every single side effect to you and every single side effect of surgery and make an educated decision. That's the way it should be done. But that doctor that you see on your local gynecologist that maybe isn't a specialist, maybe you haven't discovered the Nook yet, how are they getting their information? They're getting their information maybe from an article that came out. But what they don't look at, aside from the intro, the results, and the conclusion, is the disclosures. Is every author in that article a pharma getting money from pharma? How does that change the bias of the article? These are the questions, wherever you are in the world, I want you to start asking. Because how that bias is how it impacts how you're receiving your care. The other thing to think about is maybe that doctor who doesn't have a lot of time because they're seeing C-sections and they're doing pap smears and they're doing pelvic pain and maybe they do one endometriosis surgery a month, they get their information the easiest way they can because doctors are over inundated with patients right now and it's a really hard time to be in medicine. So somebody shows up and gives them a packet and they think, this brochure is great. Of course, it says all the things my patients complain about. Pelvic pain and pain from sex and sleeping all the time and missing school and stomach aches. It's so marketed to exactly what they feel. Who did the packet though? Pharma. The pharma rep that comes into your office, they designed the packet. And so is that where you want to get your information from? It's not a neutral source. And so that impacts your care tremendously. A new drug came onto the market last July. I found it absolutely shocking that an independent review of the drug said that this drug is no more effective than birth control pills, and it's about 5 times the price. And it contains side effects that included suicide and suicidal ideation, bone loss, and side effects that will impact you the rest of your life. And pharma somehow managed to rally to the right people and to get their money to push that drug through. And it was a huge step back because now that doctor that isn't an excision specialist, they're just so happy to offer you that drug because honestly, we have pelvic pain and we're a difficult population to treat. We come in like, my people with groin pain, they go into the doctor, they're like, I have cramps and my labia hurts during my period. And the local gynecologist is like, I don't know what to do with you, take this drug. Mostly because I think they want you to go away. And so pharma inciting this easy solution impacts care a lot. And then don't forget, pharma's goal is pharma's profit. It's not for you to feel good. It's not for me to go play tennis. It's not for that person to have a child. Their goal is for you to give them money and sort of get out of their hair. And so everything that happens in terms of endometriosis, if it isn't driven by a neutral playing field and it is driven by a drug, changes care anywhere that you are.
For a lot of people listening, I think that, and even people not listening just throughout the world, surgery scares a lot of people and the idea of it. And I know people who were hesitant for a while to have endometriosis surgery and excision surgery, and they think that maybe taking a medication to manage their pain or using, getting a medical marijuana prescription or using CBD or all of these other alternatives that can help to manage the symptoms, but they're still in pain every day. They might think that their bodies have a bad reaction to surgery or that it's just not something that they want to do at this current moment in their lives. But one thing I know, and you could talk more on, is it's best to treat endometriosis as early on as possible and to not let the disease continue to grow inside of your body for longer and longer periods of time, because then it gets even harder to remove and you get more symptoms and sicker from it. So what advice can you give to those people who might be hesitant to get excision surgery?
Managing symptoms of endometriosis with medical marijuana, with pelvic floor physical therapy, with physiatry, nutrition, and all of the things that help manage pain with endometriosis, that's a perfectly acceptable thing to do. But what we should do is educate the person that is choosing to do that, is that that should be a choice. Most people that are doing that and avoiding surgery, it's because they're not educated enough to understand how much better they could feel. And so for years and years and years, they've been pushed around by doctors who haven't heard them. They've been sold many times snake oil cures by the natural health industry, even though lots of stuff from the natural health industry works. And so they think, I'm going to take the path of least resistance. Sometimes closing your eyes and jumping off the cliff and taking a really big chance pays off really, really well. And so to have surgery done and to have surgery done the right way makes a huge difference. To find an excision surgeon who understands multiple causes of pain, that it isn't a quick fix, that it's not just about narcotics afterwards, that it's about treating the whole person, makes a huge difference in somebody's life. And so again, I get back to how we started. I listen to the patient. I hear that they're scared. I'm scared too. I mean, it is like, I always say, it's having surgery is like driving into a wall at 100 miles an hour, like, and just like letting go as you hit the wall. But you can heal from surgery. Good quality surgery will attend to the root of the disease. It will help AMH or egg quality levels improve, or rather not decrease as fast. I don't want to say improve. It can protect your fertility. It can protect your spine. Now we know it can protect your bladder and your groin. And so sometimes it's a matter of supporting the person who's scared for a little while until you can give them enough education. What a beautiful project that this is, because you can watch this video over and over and over again. Maybe you miss a sentence. Maybe you want to hear one more thing until you can find in your heart what treatment is right for you. So is surgery right for everyone? No, there's always going to be that person that's scared, and I'm always going to honor that. But to treat the disease at its root, that's your bang for your buck, because you can cover pain all you want with CBD or with birth control pills, but you haven't done what's at the root. And we just have to be there and have a presence with that person until they're ready to make a different decision. And patients are allowed to make whatever decision that they would like. And many times you have to remind yourself they're allowed to make the wrong decision and they're allowed to make the right decision. And I just have to provide a presence for that. And usually, because I lead by example, they see the difference. Last year at this time, I wouldn't have been able to come in and do the interview with you, but I wouldn't have been able to sit like this for this amount of time. And so my patients see this is what good surgery did for her. Look at her, she's able to do all these things. Like I couldn't walk across in the street in New York City without like needing to grab myself. So I think if we lead by example as people who have come through the darkest part of the disease, then we can train and teach the next generation.
And you're clearly so extremely educated on this topic, so I'm really glad that you're sharing all of the information that you have, which translates into the next big question I have for you is in regards to the Endometriosis Summit that you organized and created and had the whole vision behind. That was pretty recent. It was last month. And can you talk about that and whatever you think is the most useful information for people to know about the summit and what the goal was and what the outcome of it was?
In order to move the paradigm of endometriosis forward, it's going to take our voices. It's going to take the voice of the patient. It's going to take the voice of the doctor. It's going to take the voice of the practitioner. And we're going to have to all unite together to move forward beyond crummy standards of care and retrograde menstruation. And until we're united, there's not going to be any change. And so I sat down with Dr. Andrea Vidali and I said, hey, we could have a conference and we'll invite doctors, practitioners, and patients to all be together, because you learn just as much from the doctor as you learn from the patient. I learn from my patients every day. And we'll put that up, like how many people could come. And so we got a room, we went to our hospital, CarePoint Hospital in Hoboken, and they said, we have this room, it holds about 90 people, you could have that for free. I said, great. We made a little logo and then we put it up on Instagram. In 2 days, we had over 250 registrants. So then it became an entity of itself. And so what that says is we're all sitting around waiting to join together and to move everything forward. And that's our goal. We have lots of plans for the Endometriosis Summit for the future. Our dream is now we want to do a 2-day event. We want to teach you how to advocate. We want to teach you what endometriosis is. And we want to hear more from the patients on how doctors can change on a political level endometriosis. And so it was such a well-received thing that the largest patient-based conference, endometriosis conference in the United States, that it's time our voices are heard. We have plans to travel the summit, not only to different areas in the United States, but we have some invitations to go to Europe and to go to Brazil. And I just really believe that if we can get these little pods of education, we can just form one big zombie mob at some point.
And I was so fortunate to be able to attend the summit, and I was looking around the room that day and there was husbands and boyfriends, and you really felt the support and the love and how people really wanted to be educated and to advocate and show how much they cared and they are aware that change needs to be made. So it was really an amazing, amazing event.
We believe that endometriosis advocacy should be a neutral experience. So I guess if pharma had a great study, I would present that, but we wanted it to be a neutral playing field. We wanted it to be a positive experience for everybody there, because it's so easy with endometriosis to sit at home, watch Netflix and cry. I mean, I probably did that last weekend. But we have to provide an outlet where we all feel good about the future. The other thing that I was tremendously proud of with the Endometriosis Summit, we did everything that we could to be gender inclusive. And so it opened that door that everybody felt welcome and everybody's voice matters. And I think that's how we had so many partners speak up and stand tall, because there was no shame or anything that went on in the Endometriosis Summit.
So for everyone listening who has endometriosis and is struggling and hasn't been able to find appropriate care, what advice can you give them?
Be your own advocate. Never lose the power of your own voice. Never forget that you have a voice and you can change your care, and there is always a way out, and there is always a group of people with endometriosis ready to surround you and to support you. So I love avenues like Nancy's Nook to teach you how to be your own advocate. I also love many of the support groups online. There are even live support groups in many towns. I just spent a whole slew of time down in Texas with Endo Invisible is a fabulous group, and Endometriosis Support of Houston is a wonderful outlet. And you always need to know to join together and to use that power. If you have educated yourself and your doctor is telling you that birth control pills, pregnancy, or hysterectomy will fix your endometriosis, then you know enough that that's wrong. And you shouldn't lose hope. You should find that voice, light it up until you find the help that you need.
Thank you. And where can everyone contact you?
Everyone can contact me on SallieSarrel.com. They can find me at drsallypt on Instagram and Twitter, and they can find me on Sallie Sarrel on Facebook. I do just to encourage that my parents were very creative, and they spelled my name Sallie, so you have to know how to spell it to find me. But I'm hanging around the Nook if you want to give a holler and you need some help. And if you tag Endometriosis Summit, also has its own page, and we try to get back to you and we try to provide you that support that you need.
Thank you for being here today and for sharing this really valuable information that I know will help so many people suffering.
Thank you so much for having me.
If you can relate to this video, please leave a comment below and share it with anyone else who you think may benefit. Thank you.